Hi, my name's John Leddy. I'm from the University of Buffalo, and I want to thank the NCAA Grand Alliance for inviting me to give this talk today on rest and exercise after sport-related concussion. I have some disclosures. They do not affect the content of this talk. The objectives are to, in the end, have you described as strict or prolonged physical and cognitive rest, so-called cocooning, is not effective for facilitating recovery from concussion, but light physical and cognitive activity and limiting usual screen use within the first 48 hours of injury facilitates recovery from concussion. And finally, a prescription for individualized heart rate-based aerobic exercise treatment facilitates recovery from concussion and reduces the risk of symptoms persisting for more than a month. So cocooning doesn't work. This was a randomized trial in 2015 by Danny Thomas from Wisconsin. And they took almost 100 patients who were younger and seen within 24 hours of concussion, and they randomized them to strict rest for 5 days versus usual care, which is described there. And if you look at the survival curve on top, the intervention group in I took longer to recover and reported significantly more daily post-concussion symptoms than the usual care intervention group. So this was a randomized trial confirming that cocooning, in fact, is not only not useful, it's actually probably harmful to concussion recovery. So strict rest does not facilitate recovery from concussion. However, if you give adolescents after concussion advice to essentially do nothing, i.e. rest, up to about a third of them will experience persisting symptoms after concussion beyond 1 month. And this impairs their participation in school, physical activity, and reduces their overall quality of life. So this is the group we're very interested in making smaller. So there is an opportunity to treat sport-related concussion early after injury, both to facilitate recovery and to reduce the risk of persisting symptoms. This is the systematic review that came out of the Amsterdam conference in 2022 and was published in the British Journal of Sports Medicine in 2023. I want to acknowledge my co-authors for getting this over the line. Again, just to prove that we did this systematically, I'm not going to go through this whole thing. In the end, we had 46 studies that were included in the review. This is a forest plot of the studies looking at early physical activity and prescribed aerobic exercise treatment for the effect on recovery. So we have the exercise effect on the left versus the control, which was either rest or a placebo type condition like stretching. And when you look at the overall results, you see that there was a significant improvement in recovery. We did a meta-analysis that showed that subsymptom threshold aerobic exercise testing based upon formal exercise testing should be prescribed to adolescents as soon as 2 days after sport concussion, and it facilitates their recovery by about a mean of 5 days with a range of about 3 to 7 in terms of the confidence interval. And when you look at the quality of the evidence using the grade recommendation scale, the quality of the evidence is high because there are several well-done randomized controlled trials in the database. This is one of them, which I think is the most important one. It was an AMSSM grant that we received. And in this trial, we randomly assigned adolescents after sport concussion within about 5 days of their injury to either aerobic exercise based upon the individual heart rate threshold on treadmill testing, or to a placebo-like stretching program. And what you see after about a week or so is that the aerobic exercise group starts to separate out from the stretching group, which is in blue, and the slope of this line indicates they recover faster. Now, at the end of 1 month, approximately, we still had some patients who were symptomatic. It was about a fifth in the aerobic exercise group versus about a third in stretching exercise. And when we did an intention to treat analysis that controlled for sex, site, and mean daily exercise time, the risk of having prolonged symptoms, again, beyond that 4-week time point, was reduced by 48% in those who received aerobic exercise as opposed to the placebo stretching program. And again, this is very important, and the first study to show that an early intervention actually had a significant reduction in a later outcome, i.e. Persisting symptoms beyond a month. Now, that doesn't mean that's the only time you should use aerobic exercise, although we've shown that the earlier you do it, the better the results and the fewer of your athletes are going to go on to that delayed recovery. Dr. Kurowski did this randomized trial out of Cincinnati where he took kids in the ED who were already symptomatic beyond a month, and he randomly assigned them to either aerobic exercise or placebo stretching. And there was a run-in period of about a week there. And then after that, those who got aerobic exercise recovered faster than the stretching exercise group. And that was statistically significant. So aerobic exercise can be used in young athletes, even if they have persisting symptoms beyond a month, although it's usually one arm of a multidisciplinary treatment plan. What about screen time? This is important since everybody has screens now. This was a well-done trial out of Boston, published in 2021, where they took patients aged 12 to 25 who were seen within 24 hours of concussion and randomly assigned them to screen-permitted or screen-abstinent groups and asked them to do this for the next 48 hours. And when you looked at the screen time permitted group, and again, up in the corner is the survival curve, they had a significantly longer time of 8 days to symptom recovery compared with only 3.5 for the screen time abstinent group. Now, it wasn't like the screen time abstinent group didn't use their phones at all. In fact, when you looked at the data, those who were allowed to use their screens had a median time of 630 minutes during that 48 hours compared with 130 minutes in the abstinent group. So again, it was just by reducing the time of screen use, their typical screen use, that had a significant effect on their symptom recovery. Now, I want to talk about more than mild and brief. If you have access to exercise testing, that is, if you're working with college athletes or high school athletes or professional athletes, you can use the data from the treadmill test or the bike test to prescribe subsymptom threshold aerobic exercise as early as 2 and up to 10 days after sport concussion to facilitate their recovery. And the prescription is based on the individual's heart rate threshold at the more than mild symptom exacerbation point during the exercise test. And so subsequently, when we're having them do aerobic exercise training or any physical or really cognitive activity or in the early stages of concussion recovery, we ask them to stop the activity if there's more than mild and brief concussion symptom exacerbation. And more than mild is defined as an increase of more than 2 points on a 0 to 10 scale when compared with the pre-exercise resting value. And brief means symptom exacerbation duration of less than an hour. So if someone's exercising and they're reliably going up more than 2 points, or their symptom exacerbation is lasting more than an hour, we want them to take a step back and modify their exercise routine to where they weren't experiencing those intense or prolonged symptom exacerbations. But basically, people can follow this pretty easily, and we progress this systematically based on establishing a new heart rate threshold on repeat exercise testing every few days to every week, depending upon whether you're dealing with college or pro athletes every couple of days to every week for a high school athlete, for example. And if you don't have access to exercise testing, there's a way to do this systematically based upon the degree of symptom exacerbation experienced during the prior bout of aerobic exercise. We have publications on that. And this is one of the tables from the publications saying that if your symptoms go up by only 1 or 2, 0 or 2 points, 0 to 1 point, you continue on to the next stage where you increase your heart rate threshold training heart rate, target training heart rate. If your symptoms go up by 2, let's say during that 20 minutes of exercise, you would remain at the same stage until 2 continuous days without symptom increase. If you went up by 3 or more points, though, we want you to go back to the previous stage until you can do that stage without more than mild symptom exacerbation. And this is one way to do this based upon just how you're doing on your exercise bout, not without necessarily requiring repeat testing. So physical activity and exercise and even cognitive exertion should be stopped if the concussion symptom exacerbation is more than mild and brief, but it may be resumed once the symptoms return to their prior level. So that's important to know. And studies have shown mild symptom exacerbation during physical activity, during prescribed aerobic exercise treatment, or during cognitive activity is typically brief and it does not delay recovery. That's the important thing to know. Mild symptom exacerbation is not harmful. I mentioned screen use. We also looked at sleep disturbance in the systematic review. And sleep disturbance is common after concussion. And in the 10 days after sport-related concussion, it does appear to increase the risk of persisting symptoms. So this may warrant evaluation and treatment, especially if it's not improving. So we always talk about good sleep hygiene and things to get them back on a normal sleep cycle as much as possible. And I just showed you the data that reducing their typical time spent viewing screens during that first 48 hours facilitates recovery. And again, athletic trainers and therapists and doctors who are seeing athletes within the first hours or first 24 hours can do this effectively. However, there's no compelling evidence that reducing screen use beyond the first 48 hours after sport concussion facilitates recovery. So, recommendations. Strict physical and cognitive rest, so-called cocooning, until the complete resolution of concussion-related symptoms is not beneficial for sport-related concussion. Relative rest is, and this includes a return to light physical activity such as walking, easy activities of daily living, and limiting intense cognitive activity and screen use within the first 48 hours. These things will facilitate recovery. So does getting adequate sleep, we believe, although we do need more data on sleep and recovery. And again, the light intensity physical and cognitive activity should not more than mildly and briefly exacerbate their concussion symptoms. As long as it's not more than mildly doing that, the activity can be continued for as long as they'd like to do it, cognitively and physically. Now, if you're going to really treat athletes, the best way to do it is to do individual subsymptom threshold aerobic exercise that's based upon the results of formal exercise testing. And again, if their resting symptoms aren't very high, and that's defined as a resting symptom report of more than 7 out of 10 or more at rest, you can start this as soon as 2 days after sport concussion. It facilitates recovery, and it significantly reduces their incidence of persisting symptoms beyond 1 month. Aerobic exercise is also effective for reducing symptoms in athletes who are already suffering from persisting symptoms after concussion. So remember, it's never too late to start this. Concussion symptom exacerbation is typically brief, does not delay recovery, and should not prevent athletes from resuming activity or exercise after brief relative rest. During this time of treatment, advise patients to avoid risk of re-injury, contact collision, or fall until they're determined by a qualified healthcare professional to be safe for higher risk activities such as return to contact sport. So again, this is a treatment recommendation, not returning them to contact sport. Now, these principles have been incorporated into the Amsterdam Return to Sport strategy, as I've highlighted here, and you can read about this in the Amsterdam Concussion Sport Group statement. But stage 2 now is aerobic exercise. 2A is light, up to approximately 55% of maximum heart rate based on age. And 2B is up to approximately 70% of maximum heart rate based on age. And again, you can have mild symptoms while you're doing this. And the goal is to get to the point where aerobic exercise does not produce any symptoms at all. And then you can move into stage 3, which is individual sport-specific exercise drills. All of this is meant to get you to steps 4 to 6. So once you're completely recovered in terms of aerobic exercise and symptom-specific drills, not causing any concussion symptoms, you can move into the stages 4 to 6, which reintroduce contact risk. Thank you very much. And if there is a question and answer period, I'd be happy to answer any questions. Appreciate the opportunity to speak to you today.